What does it mean when a country budgets billions for healthcare but releases only a fraction of it? It means hospitals without equipment, patients without access, and a system struggling to survive. This World Health Day, Nigeria's health system is under the spotlight and the picture is far from healthy. As the world marks World Health Day 2026, Nigeria's healthcare sector faces mounting pressure from chronic underfunding, policy gaps, and a rising disease burden. Healthcare Advocacy Group, the Corporate Accountability and Public Participation Africa, CAPA, says the country has consistently failed to meet the 15% budget benchmark under the Abuja Declaration, a target that has remained unmet for over a decade. But beyond budget approvals lies a deeper concern fund release. In January 2025, the Federal Ministry of Health and Social Welfare received just 36 million naira out of 218 billion naira approved for capital projects. In 2024, only 26.5 billion naira out of 233.6 billion naira was released. Experts say this gap between approval and actual funding continues to weaken the system. The result is clear. Projects stalled. Hospitals lack essential equipment. The healthcare workers are left without resources needed to deliver care. Nigeria is also grappling with a growing shortage of healthcare professionals as many doctors and nurses leave the country in search for better opportunities. A trend widely known as Jackpot. Those who remain are overstretched. While patients are forced to pay out of pocket for care they can only barely afford. According to CAPA's Executive Director, Akimbode Oluwafemi, this reality is pushing many families into financial hardship, while access to essential medicines becomes increasingly difficult. At the same time, Nigeria is witnessing a shift in its disease burden. Non-communicable diseases such as hypertension, diabetes, obesity, and heart disease now accounts for about 29% of deaths in the country. Health experts link this to poor diet, high consumption of processed foods, and weak regulation. Nigeria is now facing a silent epidemic, one that is growing rapidly but not receiving the urgent attention it deserves. This year's World Health Day theme, Together for Health, Stand with Science, is a call for evidence-based action. The government is urged to strengthen policies by increasing the sugar-sweetened beverage tax, introducing clear warning labels on packaged foods, enforcing sodium limits, and restricting the marketing of unhealthy products, especially to children. There are also concerns about tobacco control. Nigeria allocated just 13 million naira to the Tobacco Control Fund, far below what is needed. At least 300 million naira is needed to effectively enforce tobacco laws and reduce preventable deaths. As Nigeria marks World Health Day 2026, one message stands out. Healthcare cannot survive on paper commitment alone. From budget releases to policy enforcement, urgent action is needed because at the end of the day, the true measure of a nation is not just its policies, but how well it protects the health and lives of its people. This is Weekly Lab on Pinnacle Daily, and I am Esther Oshosoya. See you next week.